Welcome to the Mind Your Mama podcast, where we dive into all things motherhood. The good, the bad, the hysterical, and the downright messy. I'm your host, Lauren Trout, a mama who's just trying to keep it real while juggling all of the things. Whether you're laughing, crying, or hiding in the pantry, eating snacks, this is your space to feel seen, get inspired, and remember you are not alone in the chaos. It's time to find your joy again. So grab your reheated cup of coffee or your wine and let's mind our mama businesses together. Hello there, loves. Welcome back to another episode of the Mind Your Mama podcast. And today's episode is a deep one, and I mean nervous system deep. I'm joined today by Elizabeth Wisniewski. She is a chiropractor and a somatic psychologist. And we are going to unpack something most of us have never learned of. It's called fawning. You know, it's that constant urge to keep the peace, to be the good girl, the selfless mom, the one who never asks for help. But it's not just a personality trait. It's a survival response. So today we're going to dig into how that shows up in motherhood, why your body might be holding more than you realize, and what healing actually looks like in your bones, your breath, and your boundaries. So if you've ever felt like you've lost yourself in motherhood, this conversation is a great starting point. And if you're ready to find your way back to you, just stick around to the end because I've got something special just for you. So, welcome. Thank you for being here.
Thank you for having me.
Yes. So why don't we just introduce yourself, tell everybody how you got into this line of work, and then we'll kind of go from there because this is so interesting to me.
Yeah, that sounds great. Well, it's such an honor to be here with you and with all your listeners and viewers. My name is Dr. Elizabeth Wisniewski. I currently practice in Ventura, California, also virtually, but I'm originally from Grand Rapids, Michigan. And I'm a doctor of chiropractic and I'm Webster and perinatal certified. So most of the people I see in my practice are newborn babies. I do a lot of preconception, prenatal, and postpartum work in my practice. And then I also have a PhD in somatic depth psychology. I'm a somatic movement therapist, a pre and perinatal educator, and a yoga teacher with 500 hours of training. So those are my main things. And I got into this just through this big experience I had of growing up with a rare retinal eye disease and losing my eyesight slowly throughout the course of my childhood and early adulthood. I had 30 surgeries. And so in undergrad, I had double majored in environmental studies and political science and had taken the LSAT, wanted to go to law school to be an environmental attorney. And about a week after I finished my undergrad, I went back home to Michigan, had my 30th surgery, and it did not go well. And when I woke up, I knew in my body, in my soma, that something was really wrong this time. And I lost the remainder of my eyesight after that surgery. So big shift in my plans. I was in a lot of physical and emotional pain for months after that. And I felt like all my dreams had just been shattered. And then I heard a commercial for a medical massage school and signed up for that. And I had never taken anatomy before. And it really made sense to me as soon as I started learning. And about 2 weeks into that program, and it was a year program, I told my dad I thought I was meant to be a chiropractor. And then I had to go back and take all my science classes. I took classes like chemistry and physics without being able to see them, having to do all the math out loud with the professors and coming up with different ways to learn. So that's what brought me to this work with the body. And then I already used the word soma one time. And the biggest difference between the body and the soma is that when you die, when you pass away, your body can still be here on earth, but your soma is gone. And your soma is that first person subjective lived experience of the body. And there's also like a spirit or soul fragment or, connection within that as well. So that's just a quick version of how I got to this moment of having 2 doctorate degrees and what I focus on.
Wow. Well, first of all, let's just talk about how incredible your journey has been and how incredible you are as a human being. I mean, that is just remarkable. And Sometimes when I feel down on myself or, oh, it's too hard, I'm constantly uplifted by women like you who just are trailblazers and are just ass kickers. And I'm so honored to be in your presence. So thank you so much for sharing that and for all the work that you do. Even though it hasn't been an easy road for you, you still are doing it and you're still kicking ass at it. And I'm so impressed.
Thank you. I appreciate that. Especially, it's always nice to hear that too, because we're not, we see the highlight reels on Instagram of other people's lives. And then behind the scenes, it can be so messy. And so I definitely, I'm like everyone else and get down, even though I know I've worked really hard and it hasn't been easy. So I really appreciate that.
Yeah. I mean, I think it's good to shed light on all of it, the good, the bad, and everything in between, and just be as real and authentic as possible. So I am very happy to have you here. So I want to start with a question about the nervous system from a somatic and chiropractic lens. How does motherhood impact a woman's nervous system, especially in the early postpartum months?
Oh, wow. That's a big question. And, we can look at these two main branches of the central nervous system first. So it's going to be sympathetic and parasympathetic. And sympathetic is, an area we'll be diving into later, I'm sure, in this interview. But the sympathetic is often referred to as fight or flight, but there's these other F words. And I always tell people, you're going to choose an F word or it's going to choose you, because it's beyond fight or flight. There's freeze, there's fawn, which you already alluded to. There's feigning, there's flocking, and there's also fornicating. They're all parts of that sympathetic part of your nervous system. And where that nerve, the ganglion, all those nerves are located is in kind of your mid-back. So starting at T1, so kind of upper back, the first thoracic vertebrae just below your neck, all the way down into your upper lumbar, so into your low back. And that's that big chain that goes up and down there. So that's your sympathetic part of your nervous system. Then we can talk about the parasympathetic, which is our rest and digest. And that's where we heal on the cellular level. And those are in your cranium. So we have all these cranial nerves. So nerves 3, 7, 9, and 10, parasympathetic in your head. And your low back and your sacrum, that big flat bone there is a sacred bone. It's the seat of creativity, S2 through 4. So just right there in the middle of that big flat bone in your low back. So that's our parasympathetic. So when you think about things like getting craniosacral work or chiropractic work, we can focus on those parasympathetic, the top and the bottom, to really help you unwind. And that's what I do a lot of times as a perinatal chiropractor, is helping moms drop into their bodies. Because the nervous system of your baby is the first thing to start growing within embryology. So it starts at that sacrum and moves all the way up. So that's starting before that day 22 of the pulse of what becomes the heart. And it takes about 18 months to develop. So if we were to have a gestation period, we'd almost be like an elephant that has a 22-month gestation period. So when your baby's born, their nervous system isn't complete yet. And they can't self-soothe. And they need to have you as their mom, as their caretaker, to co-regulate their nervous system. They're already really used to your heartbeat, your breath, and your feelings, your emotions. They experience those in utero during the birth. And that's why being skin to skin, there's so many benefits to that. But on your chest, you're helping co-regulate their own nervous system. So then for you as the mom, it can be really hard. And we want to pay attention to PMADs, so like postpartum mental health, like anxiety, depression, and everything, because that can definitely impact the whole nervous system of the family and your baby. And there's no shame with that. Like, it's good to get help. But the nervous system can be upregulated, meaning you're in fight or flight, you're in that fawning, that staining. And then you can go on social media and feel like, I need to be a better mom. I'm not doing enough. My birthday parties aren't good enough. And it just can up regulate. So an example I've had in my practice, and I have to do this very gently, is I'll have parents in this, within their first baby, and I'm working on the baby, and it's just gentle holds, like I'm testing a tomato if it's ripe. That's the pressure I use. I'm not like manually cracking or adjusting the baby's spines. And they know that, and they're just hovering, and I can feel the baby reacting to that. And then gently, I have to say something like, what if we are so present with the baby when we pull back some of this, like pull back a little bit of that presence just to recenter them. And then we take a breath. And I've had parents come back months later and they're like, remember when you told us to back the F off? I was like, that was not what I said. Thank you. Because the baby's responding. And so you're in this loop. And so I'm not sure if that's where you wanted to go with it, but I think it's important to understand kind of the anatomy and to know more about like the different parts of the nervous system.
So, okay. So a question like that's personal for myself is when I feel like I've always been in fight or flight, like pretty much my whole life, undiagnosed, but now doing my own, self-healing and whatnot. I feel like I haven't, I didn't deal with that for so long. So when I got pregnant with my first, I felt like everything was fine. But then when she was born, I had these rush of emotions of like extreme anxiety, like unable to sleep at night, crying a lot. My doctor said that I had, like the baby blues. And, maybe that's all it was. But I was very anxious. And now my oldest, she's very anxious. And she, has a hard time like self-regulating and stuff like that. So is it because I was so anxious and like constantly in fight or flight that she is the way that she is?
I mean, maybe.
Yeah. I mean, I know it's hard to say, but like, when I hear stuff like, oh, like, their nervous system is the first thing to develop. And if I, was unhealed or wasn't, as zen as I should have been, like, did I create an already unstable nervous system because I was unstable?
The good news is you can always work with your nervous system and her nervous system and to downregulate and then to even do some co-regulation, no matter your child's age, with you. And so I don't want to put any blame on you. And the baby blues, that's what we often call it within the first, week, couple weeks. And that's based on hormones. But when it goes past that, that's when it can get into more postpartum anxiety, postpartum depression that need to be diagnosed. And that doesn't necessarily mean you need to go on an SSRI, although that can be helpful. But there's so many support groups. And I've done other training with Postpartum Support International and their maternal mental health training because it's really important to recognize that. And so it's, I'm sure her nervous system, it was attuned to yours and trying to just regulate any way it could with yours. But that doesn't mean you can't drop in now and work with her on connection and presence and breathing and other somatically attuned and aware repair kind of modalities, such as somatic experiencing. That's a good one to look up, like an SE practitioner can really help with some of that. We also have an organization really close to me in Ojai called Building and Enhancing Bonding and Attachment, BEBA. And they actually do early childhood trauma repair from like traumatic births and have the baby maybe recreate the crawl to the breast if they weren't able to do that. And so there's really cool things out there that your listeners and you could look into as well. But somatic experience is a great thing to look into.
Okay. So it's called somatic experience?
Somatic experiencing.
Experiencing.
Yeah, it's like a really intense 3-year training that practitioners go through to do trauma repair work. And I find it to be really helpful for people. And it'll help your nervous system down-regulate. Also, it'll help you co-regulate with another person.
Okay, nice. All right. So what are some like subtle signs that a woman's body might be stuck in the fight, flight, fawn, or freeze mode? And how does that manifest emotionally and physically?
Well, when we're talking about in postpartum, it could be tracking every little thing on apps of like, this is how many ounces they drank. This is when they slept, and like getting really obsessed with it.
Yeah.
That can be a sign for us. Like you mentioned, not being able to sleep and having anxiety. And at first, especially with that first baby, it can be pretty common to be like, are they breathing?
Mm-hmm.
And I can see it felt like, because you're on high alert, that's your job to keep them fed and alive and healthy, right? But when it becomes too much in these obsessive tracking, that can be a big sign. Also, I mean, it's hard when you have a new baby, especially if they're crying a lot and that, colic isn't a diagnosis, it's a collective of symptoms. But when they, might have a colicky type baby, that can be really hard. So then lack of sleep and all of that kind of fans the flames there. And it's really hard because you might not be eating enough too. So there's a lot of basic things, but you almost have to in postpartum check in with yourself, like you're a newborn, of like, what do I need? I need to drink some water. I need to take a nap. I think I need some food. Like basic necessities can kind of down regulate your nervous system a bit. And then having your baby just on your chest will help too with that. But a lot of it can just be like hypervigilance is a sign of that.
Okay. I definitely had that as well. Like when you said tracking, like how much they ate, like, I mean, I'm joking. It was like I had pages of notes.
Yeah.
I look back and I'm like, oh my God, how did I live?
Yeah, instead of following like the cues and the body signs, then the hypervigilance, which only often I witness just can stress people out even more.
Yeah.
And that can be, but it's really tricky when you're recommended to triple feed your baby, let's say, and you're trying to get weight on them. That can stress moms out more. But then we need to go back. So like some of the stuff I'll do is I'll be like, okay, you're in a hospital birth. Did you have an IV? And if they're like, yeah, I'm like, okay, well then your baby, you're swollen, right? And they say, yes. I'm like, well, your baby was swollen too. So that weight was actually inflated at birth. So they haven't lost as much weight as you probably think. And so we just have to back it down, look at it from a different perspective. And those little things can really help. So that's where I find my job. It's not even me doing adjustments in those moments. It's just adjusting their mindset.
Yes. And I think that it's so hard to, like, we were never taught ever to like listen to our bodies or to tune into what it's telling us. Like we live so much in our heads that like we're just in constant go mode and it's hard. So like what are some things or signs of it showing up in your body that we can be on the lookout for?
Oh, I really like that you said like we were taught to be in our heads. I just did a post on this last week on my Instagram of talking about mind over matter because, that's from Descartes and I think therefore I am. And that's what led to mind over matter. However, when we look at the root word of the word matter, it comes from mata, and that literally means mother. And so, and body. And so I really find that interesting. We don't need to like tough things out or be mind over matter. We can drop into our body and have that connection because there's a lot of wisdom in that, the somatic experience of our body. So listening to it, there's three pillars for somatics, which is interoception. So interoception is like, I'm noticing my heartbeat. It's faster right now. Like when you're in that flight response, right? And you feel your heart just going, or shallow breathing. Those are interoception awareness methods of just being like, I have this pain or, this itches, whatever it is. I'm being aware. But in terms of sympathetic dominance, like we've been talking about, it'd be like increased heart rate, shallow breathing, shoulders come up. I tell my patients, I'm like, your shoulders are not earrings. It's dropping them down. So it's about breath. And then the next pillar is exteroception awareness of what's happening in my environment. And then the third pillar is proprioception. Where is my body in time and space? And so tapping into these things all around us. So basic mindfulness has really helped us. So that's why doing something quick, like a body scan meditation, just for a couple minutes, maybe starting at your feet and working your way up and just notice what you're noticing, that can recenter us and help us. Or I'll have my patients, and this is all based on anatomy and physiology, to release their stealing muscles. It's ear to shoulder to the side. Maybe they'd bring their arm up over and I just hold. So we start stretching the muscles that bring the ribs up and down. And so doing that on both sides can really help. And then just shoulders down and back, little cues. So if you notice your shoulders are earrings, you're probably a bit stressed out and it's time to reset.
Okay. Yes, I'm always so tense in my shoulders for sure.
Wow.
Every mom is.
Oh, yes. I know. That's why I have to practice this stuff.
So, what does fawning look like in motherhood, and how might it show up as overgiving, people pleasing, self abandonment?
Yeah.
Thing.
Yeah. So fawning, something isn't talked about, like you said already. We mostly will focus on fight or flight. Is fawning and even feigning, which are similar but slightly different, are often overlooked. And so fawning can be really hard with our social media culture, especially of, these people through like this huge birthday party with all these, I don't know, animals and bounce houses everywhere. And now you feel like you're a bad mom because you're not a Pinterest mom. And so you want to people please. And it's all about that self-sacrifice. And you're taught that self-care is selfish, when really it could be like a ritual for regulation. And it shows up with moms staying up really late to get lunches ready, to make everything look perfect at their own expense. And that you need to give up everything for your family, for everyone around you, and that you come last. But that's not going to help your family and the family's collective nervous system. But that's what we're taught. And you mentioned this already, as girls, as women, to ignore the body and put ourselves last. So like I said, self-care is not selfish. So giving yourself some time to go get a pedicure or to get a massage is going to help your nervous system reset, to down-regulate, and then you can show up more for others because you've shown up for yourself. And then the difference with fawning and feigning is when you're like full on fake it till you make it. I'm just going to paste on a fake smile and say that I'm fine. So it's another level of fawning where you add that layer of lying to yourself, really, and faking it to other people that you're okay. And I think a lot of moms do that just in order to survive. And it is a survival mechanism. It's part of our sympathetic nervous system. But I think it's time that we as women give more to ourselves so that we can show up in a better way for the people around us that we love.
Yeah, I completely agree. Self-care used to be something that I would it would just be like a trigger word. Like it would upset me because, then I felt like it was yet another thing that I had to take care of everything in order to go do, get a pedicure or get a massage. Who's taking care of the kids? Who's doing that? But, it doesn't have to be this big, experience. It could just be, drinking more water or reading for 15 minutes or whatever, you can, to kind of slow down. And that is something that I really want to hone in on and let people know that I get how frustrating that term is and how that goes for you. But it is so important, like you said, so you can show up and be better for everyone around you, which I always say moms are like the heartbeat of the home and create the environment. And if you're stressed and anxious and you're constantly in go mode, everyone's going to be like that. And then their nervous systems are going to be shot. I could feel it even this morning in the house. I let the kids sleep in a little bit before school. And then I was like, oh no, now we're rushed. And everyone's like, why are you so stressed? And I'm like, we're late and we got to go. And, so I created that environment by being so stressed. So you mentioned about social media, playing a big part as to why we feel like we're not doing enough and how as a culture, we praise like the selfless mom and the mom who can do it all. But that totally feeds into these fawning like behaviors. So can you speak to any long-term consequences on a woman's identity, health, relationships when we're constantly, you know, putting our needs last and being that selfless person?
Yeah. I mean, your body is going to respond and do its best to go into balance, but it's gonna break it down. You're gonna have chronic, tension in your body, which can lead to chronic pain, changes in your posture. And when you're all hunched over, I'll tell people, I'm like, you're gonna have a hard time communicating within your own body, hard time communicating to others. Because even just being that hunched over posture like that, your heart space is, shut down. How are you going to communicate better with other people? So it can have long-term impacts on the posture and pain and movement patterns in your body, which isn't going to feel good. And then I also think a lot about what are you going to do when your kids eventually leave your home, and then you might feel like there's no purpose. And so that could have long-term consequences too, as well, in terms of more anxiety, like in depression. So I think it's important to pay attention to that when you're just giving. Then where do you put your time and energy and everything into? Or is that pattern going to perpetuate and now you're having lots of anxiety because your child's at college or off working? So I think it's important to put together these small rituals, like you said, little things, maybe a little like lavender oil in your shower or oil diffuse, sipping some really good tea like lemon balm to downregulate your nervous system. There's little things we can do throughout the day. I have a Siberian Husky. I'll go just like lay with him or pet his face, and that helps my nervous system downregulate. There's a little moments that we can create these rituals to downregulate so we don't end up in a crisis, because these things will catch up with you. You can't just give and give, because you're going to have nothing left for yourself and you're going to be burned out. Your adrenal glands are going to be hating you. Your cortisol levels. And so when our cortisol goes up, we are more inflamed. We're going to feel worse in our bodies. That's going to depress our immune system. We're going to get sick. So none of that sounds good to me as a holistic doctor.
They're not.
You're right. Your supplement. Take some adrenal support, right? That's a little ritual you can do every day that's so quick and easy.
Yeah.
Work for you in the long term.
I love that. What's one thing that you wish that all moms knew about their bodies and their boundaries, especially during and after pregnancy?
Ooh. Probably about being touched out, and that's really normal to feel touched out, and to set boundaries on your bodies of, mommy doesn't want to be touched right now. Like, can I give you a hug? And then like, I need a little space. However you want to create that boundary, that's okay. Because it's a lot when you're breastfeeding and your other kids climbing on you. I have a lot of moms coming in that are just touched out. And then part of me is like, oh, sorry. Like, you're at the chiropractor. I'm happy touching your body. But it's a difference. I think that's a really hard boundary. I witness a lot of moms having that challenge with that, because you don't want to like push your kids away. You want to have connection, but there's other ways to connect with them, and just letting them know, because that's going to help them. And we can stop this intergenerational patterns of things like fawning if we set the boundary early. And it can be in a nice way, but it's definitely worth setting that boundary.
Yeah, I can totally speak to and feel deep in my soul the being overtouched. I'm like, I just stop touching me. It's just, that in and of itself is exhausting. And it's like, oh my gosh, just leave me alone. So I do wish that I had known about all of this stuff, when I was pregnant with my first, and even my second and my third. Like, this stuff is so helpful. Can you explain how unresolved trauma or emotional stress might show up physically in mothers, besides like chronic pain?
Yeah. That's the question again.
Yeah. Yeah. Can you explain how things like unresolved trauma or emotional stress might
Mm.
show up in physically in
Mhm.
moms?
Yeah. So I'm thinking about a case I had a few months ago with a postpartum mom. She was about 5 months postpartum coming in, but her shoulder was really bothering her. So it wasn't necessarily pain. I was adjusting it. She was seeing the PT and she's like, I don't know what's going on with this shoulder. Until one day we were chatting and I was like, I don't practice traditional Chinese medicine. I'm not an acupuncturist, but I know some of the meridians. And right here in front on your pec here, that's your lung meridian, and it's where you hold grief, and what they say within Chinese medicine. And then it all came to her. Her mom had passed away a few years ago. Then she became a mom, so now she's a mom without a mom. And he had a lot of trauma coming up from that, of not having someone to go to for advice. And she was holding it in her body.
Oh,
So I think that's, and that can show up in different areas. And so and it was really a moment for me in practice because I'm doing a lot of preconception work right now because I would like to have kids within this next year or so. And my mom died when I was 14 from breast cancer. And so I've had to do a lot of unwinding personally in my body where my pelvic floor is so tight because I went to school for 16 years and coming like, all kids later. Now I'm like, okay, I'm ready. And, and then was working with my best friends as a pelvic floor PT. And she was working on me. She's like, you have one of the tightest pelvic floors I've ever worked on.
wow.
And it was guarding and gripping my womb to protect it. So when my patient said that of being a mom without a mom, it was really hard for me not to just cry. Because I'm like, oh, it's literally here in front of me, exactly what I've been feeling. And she just put words to it. So guarding, gripping, tension. So they might not be physical pain as we think about it, especially as compared to childbirth. But it's those sensations, like I talked about earlier, things can show up in our bodies and they're there for us to pay attention to. Pain is the last thing to show up often, first thing to go away. It's just a warning signal. So we need to pay attention to that. Pain isn't bad. It's kind of like a fever. When people are like, oh, I have this fever, I'm like, that's awesome. And they'll be like, what? And I'm like, your body's working. That's sick. Great. So hell. So we're rewriting that paradigm all the time. Sensations are important for us to pay attention to because they're always teaching us.
Love that. Okay. How can new or seasoned moms start to tune back into their own needs without guilt, especially when they've spent years to decades ignoring them?
I'd say get into therapy. Number one, some sort of therapy, whether it's talk therapy, but also really somatic therapy would be really good. That's really important because if it's been years and decades, it's really built up and it's held in your fascia, it's held in your body, all that connective tissue. So you can find even someone who's done extra training in fascial release and have it literally like unwinding, coming out of your body. That's one thing. I've had that done. And all of a sudden, you're just crying. And it's releasing. You hold it in the tissues. And so it's coming up and out of your body. And that's really powerful. So if it's been there, if you've been holding these patterns for a long time, it's not going to change overnight. We don't put braces on your teeth for a day and you have straight teeth. Things take time in the body. So time and repetition. But I encourage most people to be in therapy of some sort or a coach, something, because we need somebody else to talk to. So that we're not putting all of that on our partners, and having those other self-care practices like journaling, meditation, all of that. Bottling it in, holding it in isn't going to help. Anytime an animal gets away from a predator, or you should watch your dog after they get groomed, that's going to be a little traumatic for them. They all have the zoomies. When an animal gets away, they stop, they tremor, they shake and release. We don't do that as adults. We just shove it down in our bodies, and at some point, it's going to boil over.
Okay. All right. So, what are some healthy ways women can begin setting boundaries, even if it feels like they're being selfish? Because we know phoning can damage relationships by creating resentment or exhaustion. So,
Yeah.
tips.
And that's such a tricky one, right? Because you
Yep.
have to find the language that works for you and your body and your family. And you really need to do your own internal work first so that you can just say it and not have that residue of guilt. And so it starts within you of just being like, this is what I really need. And what I tend to do is like, I'll use, this goes back to my elementary school of like, I feel this way when this happens, and this is what I need. And being really explicit with my needs, which is a struggle. I think that's really hard for women. And I need 5 minutes right now to drink this tea, and just start with little things and then make it like, I need a girls' weekend. Building
Yeah.
so start small so that you get used to those words coming out of your body and out of your mouth, and then build it up.
What are some small but powerful ways or powerful somatic practices a busy mom can use throughout her day to stay present and grounded?
Yeah. Well, there's this kind of, they call it top wood, carry water meditation. That could be you're doing the dishes, but you're like very mindful, present with that, just present with your breath. So it's like a daily task that needs to be done, but you're present. So the little things like that, like I mentioned, sipping tea, putting some lavender in your shower, bringing yourself back to the moment, that's the best thing you can do. So just a couple of breaths. So breath work, I like to do like box breathing where you breathe in for 4 counts, hold the breath for 4 counts, and then exhale for 4 counts, hold your breath out for 4 counts. And do that a few times and it will really reset your nervous system. Another personal practice is like I like to put a little dab of lavender oil on the front of my heart and peppermint on the back part of my heart. So like on my spine. And I like it because I can smell the lavender and it's really grounding and beautiful for me. But then the peppermint oil is a little tingly. So it kind of reminds me of like, oh, I'm 3-dimensional. I'm here. I'm breathing. And it's just a reminder to be like, take up that space. And then I'm this 3-dimensional being right now on this earth. So those are some things I personally do on most days just to stay present. And it could be foam rolling, like we talked about the fascia, or using a lacrosse ball, a little like self-massage with a massage gun, like a Theragun or a Hyperball, things like that. It doesn't need to be much.
I love that. I love the lavender on your heart and the peppermint on the back of it.
Yeah.
It's really, I would never think to do something like that.
Yeah, I learned it at a workshop and it really stuck with me over the last 8-10 years. And I go back to it often. And when I forget about it for a while, when I come back, I'm like, oh yeah, I can breathe again.
Yeah. Yeah. I mean, that in and of itself just seems so grounding and so relaxing. So I work with moms who are overwhelmed, burnt out, feel like they've disappeared in their own lives with my coaching. So what would you say to the woman listening who is nodding along, but just doesn't know where to start? Like, I'm just so overwhelmed and I don't even know what the flip to do.
Yeah. I would want them to start drinking more water. Basic thing.
Yeah.
Adding some electrolytes, finding ones that aren't full of sugar, or some like mineral drops in your water, or pink Himalayan salt. And I always tell patients, I'm like, enough that there's some salt, not enough like that it tastes like the ocean. And to just start getting that, minerals back in your body and water, because it's going to hydrate you on the cellular level. And then you're going to have your thoughts will be more clear. So it's really basic. And then adding in some sort of movement, maybe a little yoga or stretching or on a walk, 10, 20 minutes, nothing, you don't have to be doing, hardcore HIIT workouts right now. Just do something gentle for yourself that you can drop in because that's breath, that's movement. Those little things, very basic, will help you reset.
Okay. Love it. All right. What is one belief or pattern that women should start to begin to question for themselves today when they feel like they've been living for everyone else?
Where did this come from?
I mean, I could, but it's true though, right? Like, oh, where did this come from?
Yeah. And to get back into the psychology part for a moment, Carl Jung, he talked about this unholy trinity. And I was raised Catholic, so I heard the unholy trinity. I was like, ooh, what's that? And he said it was the three things that society wanted to push away and didn't want to pay attention to. And it was the feminine, the body, and the unconscious. And so I find that really interesting. Like, this goes back generations, millennia, pushing our stories and our feelings and everything down. So I would say, what is driving that people pleaser in you? What are you getting from it? Are you getting anything from it besides burnout? Can you talk to that little girl, that little people pleaser inside of you, and just let her know she's safe, she's loved, she's hydrated, she's taken care of, and you want to take care of her in a different way now by doing something for yourself. So what can you do today? Maybe it's just an extra cup of tea or coffee if you need that, some extra water, petting your animal, an extra hug from your partner, whatever it may be, just something small that you feel grounded and present again in your body in this moment. You're holding so much for all the women that came before you, but we can change it for the women coming after you.
Yeah. Carrying all that stuff from the women before you, like, I'm just starting to learn about all of that too. And it's wild to me. And like, obviously we know it's like generational and like, oh, I was brought up this way, but it actually is like on a cellular level, like how it gets transferred over. It's crazy to me. So I'm just starting to like learn a little bit about that too. And I'm like, oh, crap.
Yes, I know. It's a lot.
It's a lot of stuff. And I'm like, oh my God, where do I start?
It's so hard. And I've been fortunate to work with, I'm pretty open to different healing modalities. So like, I have a really good homeopatist I work with who's trauma informed. I've worked with shaman. I've worked with other medicine people from all different cultures from around the world. And then, massage specialists, pelvic floor PTs, like anyone I can find that I trust and just try, to see what resonates, what works with my body and my soul, to keep unwinding those deeper layers. And one time I was working with somebody, she goes, you have work equal worthiness, which is like totally one of my tendencies. And she's like, that goes back 1,000 generations. I'm like, oh, like, oh.
I mean, it's crazy.
No, it's I'm Polish. It's like the stairs Slavic language. I'm like, it's not my fault, but also this doesn't have to be my truth for the rest of my life. And it certainly doesn't have to be my future children and their children's truth either. Of like, I'm worthy and whole and complete as I am, and I don't have to work 24/7.
Yes, I love that so, so much. So just to end things on a good note or whatever, what is one piece of advice for the woman listening today who's ready to reclaim her soul's purpose, but feels scared, not enough, she's exhausted? What's something you would say to her?
I'd say you are enough. You are worth it. You are worthy of feeling whole and complete in your body, your mind, your soma, and your soul. And so I just want all of you to hold that and know that you deserve to feel good in your body and to have it respected, keep set boundaries for it, and know that's okay and that you're safe and that you're loved.
Oh, I love that. Is there anything else you'd like to add before we say goodbye today?
I don't think so. I'm just so grateful to be here and to share. I always love to teach from, like East and Western perspectives and to bring in anatomy So I think we all should know our bodies and our anatomy, but then, take it to the cosmos and beyond.
Yeah. I'm
And
even
just
here for it.
just grateful for the opportunity. And you can find me at Dr. Elizabeth Wisniewski on Instagram, and it's a great place for me to connect on anything embodiment related.
Wonderful. Well, that was going to be my next question. So I love that. And I thank you so much for being here. I think you're a true, Wonder Woman. I think you're incredible. And I love everything you're doing. And I'm just grateful to have you on here. So thank you very much for your time.
Thank you.
You are welcome. All right, mamas. So I don't know about you, but today's episode was really incredible. So if you've been nodding your head, maybe even holding back tears, just know that you are not alone. Fawning, people pleasing, losing yourself in motherhood, those aren't personal failures at all. They're survival strategies we were never, ever meant to carry forever. But the good news is you can unlearn them. You can reconnect within your body, your truth, your purpose, and start living a life that actually feels so good to you. If this episode cracked something open in you, maybe even just a whisper of I want more, just know that's your soul speaking. And I'd love to walk with you as you start listening to her. My one-to-one coaching container is now open. It's for moms and women who are burnt out, but ready to take up space, set boundaries, feel steady in their bodies, and finally start creating the lives that they deserve, not the ones that they inherited. So if that's you, check out the link in the show notes, DM me, follow me on Instagram at mind.yourmama, like and follow along on Apple Podcasts, Spotify, or wherever you stream your podcasts. And just know that I am with you all the way because I want to be. I see you, I feel you, and you are not alone. Thanks, mamas. Take care. Hey, mamas. Thanks so much for listening to another episode of the Mind Your Mama podcast. Please be sure to like and follow along with me on my Instagram, Mind Your Mama. You can also find me at Lauren Trout. It's a business page on Facebook. And please be sure to like and follow along on Apple Podcasts and Spotify. Like and share it with all your mama friends. Feel free to leave me a comment or review on Apple Podcasts. And let me know what you want to hear. I'm always open to discussing anything that you would like to talk about. So thanks again for taking time out of your busy day. Let's keep it real. I see you. I feel you. You are 100% not alone in your motherhood journey. I got you.